What is the current state of the department? And you've covered that in part, but also transplantation.
Well, I think what really makes me sad is that it didn't take long to see things fall apart to a certain degree within the department. I thought it would take probably a couple of years to see an effect of me no longer being at the helmet. But what happened within the last 6 months really is several divisions have completely disintegrated. This is true for transplantation. We did anywhere between 120 and 160 transplants per year. We're now on a path to do probably 20 to 30 a year. And that is true for all types of transplants. Several programs had to be closed. We had a nationally acclaimed auto-islet transplant program where we take out one of the glands in the body, the so-called pancreas. We isolate the cells that prevent the creation of diabetes, and we give it back to those cells back to the patient. It's only done in 3 or 4 centers in the country, and we have become the number 2 or 3 center within 2 years in the country. So this is closed. No one can see patients anymore, and the patients were told to go to other centers. The issue there is many patients don't have the means to travel to Miami or to Minneapolis or to some of the other places where this procedure is being offered, or they are simply denied access to those facilities because they are not their patients, and the follow-up is something that pays very little, and for that reason the patients are not welcome. So it has created a lot of hardship on our patients. We had to close basically our liver and kidney programs for children. That was very successful. Within a relatively short period of time, we were able to be among the top 20 liver transplant centers for children in the country. The dean, again, because of his close association to me, let the director of the pediatric or the children's liver transplant program go without being able to substitute or bring in a new replacement for him, and so the program had to close. We had the heart program and the lung transplant programs closed, and the liver program is going to be closed, I think, within a very short period of time due to inactivity. Since I have left, only 1 liver transplant has been done, and I have been told with disastrous outcome. So with regard to transplantation, everything that was built in 6 years has fallen apart, and I don't think that there is a quick remedy available at this point. The same has happened on the cardiovascular side. Dr. Poston was brought in to build a program that is based on robotic and minimal invasive surgery, a clear departure from the standard open heart surgery, which still was offered, but we wanted to give it a new direction so that patients could undergo serious heart surgery but be discharged within 1 or 2 days. And we were on the cusp of becoming one of the leading programs in that regard, again for reasons that have to do with retaliation, envy, and other things. The dean did not want him in that position and came up with charges that were unfounded. Dr. Poston did over 600 robotic surgeries with a mortality rate of about 2%. This is objectively verifiable if someone looks at some of the registries that are readily available. Whereas some of the other surgeons in town had a mortality for similar procedures that was 2 or 3 times as high. There are other areas. The chief of urology, a minimal invasive surgeon who dealt primarily with tumors of the prostate, bladder and kidney, recently left to become chair at another department out east. He probably would have stayed if I had stayed here, and he would have become chair of his own department. So with urology, I'm concerned about that. I'm also concerned about reconstructive and plastic surgery. The support that was promised was not given to the chief. The current chief is the individual who did the first hand transplant in the United States. Very successful in that regard, and the support that was promised was under the new leadership not given to him. With regards to surgical oncology, the treatment of cancer, we have seen a decline in the referrals from many of the patients that come from in town. And I think it is fair to say that the operative volume is almost cut in half for what we call elective cases, patients that seek our treatment based on what they read in the internet, based on recommendations, and based on the fact that many of the faculty are nationally known. So we are primarily now treating in the Department of Surgery patients that are trauma victims, patients that basically by chance come to UMC, but a lot of the referral basis has been taken away and is no longer existent. So the side effect of all of this has been that the regional and the national referral center, or being a regional and national referral centers in many programs, does no longer exist. And in the end, this is a development to the detriment not only of the hospital and the university here, but also obviously to the patients and the citizens of Tucson.